trust each year. We were created from the sale of the Blue Cross Blue Shield of Montana in 2013, but as we mentioned, we are an independent private foundation and we manage the trust. Our focus areas are American Indian health, behavioral health, which includes mental illness and substance use disorders, and partnerships for better health. So 2017, through our various call for proposals, we'll have 3 or 4 of them. We plan to invest more than $5 million in 2017, partly through this call for proposals as well as through our other invited grants and initiatives. We will give out 2 types of grants, large grants and rapid response grants. Today's webinar will focus on our upcoming rapid response cycle. One organization may submit up to 2 distinct proposals per year, and we do not negotiate adjustments to project budgets once you submit your proposal for review. So please request the amount that best fits your project scope of work. And so this means that we really try to evaluate the grants based on the proposal submitted, and that the grant request should not be too little and leave you handicapped in terms of trying to achieve your goals, but also they should be specific enough and right sized to make sure that it is not in excess and it can accomplish the purpose of the application. Our rapid response grant opportunity, it's a 1-step application process. We'll offer 2 to 3 times in 2017. This is our 2nd opening. The grants are typically between $10,000 and $75,000, 1 to 2 year projects. And generally these are planning grants or implementation grants for smaller projects. Our application timeline for this round is it opened yesterday. Proposals are due June 5th, and funding decisions will be the 21st. Okay, as we step into, I'll go through our application criteria and our selection criteria, but we're going to try to patch in Aaron Wernham right now as we talk about who's eligible to apply and what we do fund.
Well, thanks, Ted. Can you hear me okay?
Perfect.
All right, that's great. Well, sorry about the technical difficulties, and thanks for stepping in. So this is Aaron Wernham, and thanks to everybody again for making time to be on the webinar. Folks at my office, since I'm on the road, I can't see which slide you're on. Tell me.
Ron, who can apply? Slide 11?
Okay, great. So these are the eligibility criteria. These are the criteria we use to see if your organization is eligible to apply. So you have to be a Montana-based organization that meets one of the following 3 criteria. You need to be a 501c3 nonprofit. And to get very technical, that excludes 501c3s that are categorized as private foundations or type 3 non-integrated supporting organizations according to section 509A of the Internal Revenue Code. Tax-exempt educational institutions are also eligible to apply, and state, tribal, or local government agencies may apply. Just one special eligibility criterion to make you aware of that for the American Indian Health Focus Area, only tribal government agencies and American Indian-led nonprofits are eligible. I also like to make the point, and I'll try to make it a couple times today because the question comes up often, that even if you are eligible to apply and you want to work with a contractor who might not be eligible on their own, that's fine. We don't like to see these grants used as a pure pass-through to a non-eligible person or entity. But if you have a contractor that you want to use, for example, an individual person, we don't make grants to individual. But if you want to use part of your budget for an individual contractor, that's just fine. So on to slide 12. These are our selection criteria. And these are really the heart and soul of how we make our funding decisions. So it's very important for you to read the call for proposals in depth and just understand this is the lens that we use to evaluate every proposal that we get. I'll spend a little bit of time on this slide, just making sure that we explain the basics of how we look at each proposal. So the first thing we look at is just the importance of the health issue to be addressed. We'll ask you questions that try to draw out from you, why have you chosen this particular issue? What data do you have that indicates it's a very important problem in your community? The second is the need for funding, that this grant would fill a need that can't be met using other resources that are available in the community. The third, and again, a very important criterion that really turns out to be one of the deciding factors for some of the great proposals that we get, is sustainability. We look at our funding as a way to catalyze changes that can endure beyond the grant funding. We are not a sustaining funder of programming. So if you've got a great program and you're looking for funding to continue it, we're probably not the source for that. Or if you have a wonderful program that our grant would start and then no real plan for how to sustain it, that's again one that causes a lot of concern as we review these proposals. What we really look for are proposals that can find some way to draw on funding available within the healthcare system. So for example, after the startup expenses and the startup period, that you could sustain your project based on third-party reimbursement from health insurance, or based on some sort of an agreement with payers or hospitals, for example, to share savings that your project would generate. So we really look a lot at a solid sustainability strategy. We also look very hard at partnerships. We aren't interested in a list of partners that you already work with. We're interested in using our funding where we can to create new partnerships that will allow your community's needs to be met more effectively and more efficiently. So we're looking for new partnerships or building on existing partnerships to achieve something new with this funding. We have a very strong focus across all of our focus areas on at-risk populations and health disparities. We want to see projects that will serve a region or population that has particularly high need as a focus of the proposals. We also look at the practical aspects. We don't ask you to cite a lot of evidence, but we do ask you to make a case for why you believe your particular intervention will be effective. If that's because it's been studied extensively in similar populations, that's great. If not, you just need to make a strong case that you've got an intervention that is likely to address the health problem you've chosen to focus on. We look for projects that are workable in Montana and culturally appropriate. So we want to see, practical ideas that are well adapted to the unique characteristics of the communities that you work in our state. We look at feasibility and scale. So we want to make sure that an investment of the size that we can make is likely to lead to success. We've seen great proposals for amazing ideas where we think that the applicant isn't asking for nearly enough funding, and we've seen wonderful ideas where we think they're asking for too much, and both of those are things we encourage you not to do. We want you to right size your budget and really make a strong case for why you believe that grant will allow you to achieve what you're outlining. We look for proposals to make a contribution to a diverse grantee portfolio. We do not focus only in urban areas or only in Western Montana. We really try to spread our funding across the state to organizations both small and large that are doing good work to improve the health of Montanans. And finally, we'd like applicants to focus on best practices, on using methods and ideas that have been shown to work somewhere else, or if you have a new idea that's not been tested, explaining how you're drawing on what we know about best practices in designing your project. The final point is, if you're applying in, let's say, behavioral health or partnerships for better health, and you're not a tribe or tribal organization, we ask that you have very strong collaboration with tribal leadership. And that's a selection criterion. If your project would focus on that population, to make sure you've read carefully in the call for proposals, and we're always happy to talk with you as well. So on the next slide, we'll just go through briefly some categories of things that we do not fund. We don't provide grants to individuals, as I mentioned already. We don't fund capital campaigns or fundraising events. We don't provide grants to retire operating deficits or debt. We don't generally fund large construction projects, real estate acquisitions, or endowments. If a small portion of your budget goes to some minor remodeling, that's a question we get asked a lot, and we're perfectly willing to fund that as long as it's not the major reason for the grant. And that's really the same with other capital expenses. We are willing to have a portion of the budget go toward capital expenses, but not for that to be the major reason that you need the grant. We do not fund any type of discrimination. We are prohibited from funding lobbying as defined in the Internal Revenue Code, and if anybody has questions on that, we urge you to familiar yourself with the IRS's definition of lobbying and talk with us if you have questions. We don't support activities that involve electioneering, supporting political candidates, voter registration, again, according to the Internal Revenue Code. Large equipment purchases, I've already mentioned. That would be, if you have some equipment that needs to be purchased as a minor part of your budget, that's usually acceptable. If you wanted to use the majority of the grant for a large equipment purpose, that is probably beyond what we would fund. We don't fund medical research or research that lacks a direct, targeted, and practical benefit to Montanans' health. We get questions about this a lot. We do work with some of the universities. We do fund some research, but usually really only community-based participatory projects that have a very high chance of positively impacting health over the course of the project. That's the type of research we might fund otherwise. We're not a major research funder. Finally, we don't fund organizations or foundations for the redistribution of funds via subgrants. On slide 14, we'll talk a little bit about one special restriction that the foundation has according to state law. We are not allowed to use our grant funds to supplant government funding. And this always causes some questions. We're happy to answer them. We also have written up a brief that's on our website. But the basics of this are, you can't use a grant from us to fund something for which you already have government funds to do. So we can't bump your current funding out of the way, in other words, and replace it with our funding. We do make a distinction between supplanting and supplementing. If you wanted to use our funding to augment, expand, enhance, expand an existing program, and you couldn't do that without a grant from us, that we would usually consider supplementing, and that is acceptable. But supplanting, using our grant to replace something you're already able to do with government funds, is not acceptable. On the next slide, slide 15, we'll just kind of start going over our focus areas. We have three major focus areas that we'll fund through this current call for proposals. It includes American Indian health, behavioral health, and partnerships for better health. And a couple of things to point out on behavioral health. We will fund projects across the board that address behavioral health, which we use to mean a focus on mental illness and substance use disorders. But we also have two special initiatives under the behavioral health focus. One is focusing on integrated behavioral health or team-based care. And the other is on strengthening Montana's substance use disorder prevention and treatment system. And if you're interested in these areas, if you're a primary care provider, a hospital, for example, a tribal health center, I really urge you to read the call for proposals on these. So on the next slide, slide 16, talk a little bit about what we've learned so far in our work on American Indian health over the last couple of years. This slide really is just a summary of some of the key challenges that we've found in the state. It's by no means an exhaustive list. There are many other challenges, but these are some of the areas we've found particularly in need of our grant making. So inadequate funding of health services and disease prevention, which is a very long-standing problem in the Indian health system. There's a lot of need for technical assistance to strengthen administration, coding, billing, compliance, and the tribal health system. We know that around the country, tribes run some of the best health systems in the country, and that takes a lot of technical expertise to kind of get up that hill. So we really do support tribes that are wanting to move in that direction and need our funding to help take steps. There's a limited availability of treatment for substance use disorders. We know that young families face a lot of challenges: historical trauma, lack of economic opportunity, adverse childhood experiences, and perinatal drug use are all challenges we've heard a lot about working with American Indian communities. Suicide and mental illness, oral health challenges such as limited access to care and prevalent dental problems, and other health disparities like diabetes. So on the next slide, we'll talk about some examples of the types of projects that we fund in this area. And again, this is not an exclusive list. You're welcome to propose projects that are relevant to American Indian health, even if they don't appear on this list. These are just some of the common areas that where we've found ourselves issuing grants over the last couple of years. Again, addressing some of the challenges I just outlined, we've provided quite a number of grants to strengthen the funding and administration of health services and prevention programs. Strongly supportive of tribal self-determination through using Public Law 638 to contract or compact with the IHS to provide services. Providing funding for strategic planning to allow tribes to define their own solutions to health challenges that they face. Grants to help develop programs to address drug use and pregnancy. Grants to address injury prevention, particularly when those grants will set a tribe up to tap into some of the larger federal sources of funding that come from the CDC and IHS. Addressing the health service needs of urban Indians and leadership development. So that's just a quick snapshot of some of the work we're doing in Indian health and some of the projects that we've funded in past rounds. Again, we're very open to new ideas and hope you'll give them to us in the form of a great proposal. So on to the next slide, behavioral health. Some of the key challenges we've identified, there's really around the state workforce shortages and limited access to behavioral health prevention and treatment kind of across the board. There are high rates of behavioral health disorders in the criminal justice system and a fragmentation of the system of care for people who have co-occurring mental illness, substance use disorders, and chronic medical illnesses. So on the next slide, we've got several initiatives for behavioral health, as I mentioned before, and also just our general, what we call the other behavioral health programs. And I think what I might do is let Scott take over and just describe integrated behavioral health and substance use disorder initiatives.
Thank you.
If you're ready, Scott.
Yep. Thank you. So our integrated behavioral health initiative for the Rapid Response 2 allows for organizations to apply for planning or enhancement grants for integrated behavioral health practices. We have a growing learning community and a technical assistance and training provider that works with the cohort of integrated behavioral health organizations. And again, there's a lot of information on this on our web, and there's a list of current grantees and the projects that they're involved with. And this really can occur in a variety of settings, so it's not just for one setting. There's a lot of different approaches for this initiative, but for the Rapid Response 2, there's the opportunity for planning or enhancement of your current services. In the strengthening of the substance use disorder prevention and treatment system, there's a lot of changes that have occurred with regards to the opportunities to provide services and partner for substance use disorders and prevention. And we really want to call this out and emphasize the importance of perhaps adding substance use disorders to a service array or increasing a partnership between a substance use disorder agency and a non-substance use disorder agency. We just really feel like there's an important opportunity to focus on not only the treatment system in a community, but also how the prevention framework is occurring within that community or region. And as Aaron alluded to in the American Indian focus work, this by no means is an inclusive list of what the behavioral health priorities and challenges are. So there's many of other challenges that occur in Montana, and we want to make sure that communities and organizations really apply for those challenges that they're seeing in their communities. We do emphasize a few things that was mentioned as far as the criminal justice system. We know that there's an overrepresentation of individuals with behavioral health needs in our criminal justice system, and that's a broad continuum, everything from an encounter with law enforcement all the way to the Department of Corrections. And so we're really looking at ways that a community or region can strengthen that continuum so that those individuals can be intervened with and treated in a different way farther upstream. And any project that really seeks to enhance or create partnerships is really important. As we know in Montana, our resources are sometimes scarce and our workforce is challenging, but communities coming together around some of these issues of mental illness and substance use can be very powerful. So projects that really seek to create or enhance those partnerships are really important.
All right. Oh, no, go ahead, Scott.
Just moving into the Integrated Behavioral Health Initiative, do you have something on the other slide first before we do that, Aaron?
No.
Okay. So as I kind of went through this with the rapid response too, we do have the planning grants available, and implementation grants are by invitation only. So I do encourage folks that are interested in those to contact us directly. But for this current cycle, it's really for the planning or enhancement of integrated behavioral health. And strengthening the substance use prevention system. It kind of talked about this a little bit in the first slide overview. And here's some examples of what that looks like. And by no means is this an exhaustive list, but here's some priorities that we've really heard from the communities and organizations that we're working with. Substance use and substance use disorders amongst pregnant women and newly parenting women is a considerable area of emphasis for us, and I think that we're seeing some early promise in projects that are really starting to focus intentionally on this population and providing a team-based approach to care, which includes, primary care, coordination of care, and mental health and substance use. Medication-assisted treatment, again, as part of an integrated behavioral health setting, is a very promising approach and has a lot of success behind it. And I think, again, practices that are really looking at how to incorporate medication-assisted treatment as part of their IBH setting is an area of emphasis. Again, substance use disorders, as mentioned, is really under a rapid change in who can provide the services and who can deliver services and be reimbursed with regards to substance use disorders. So hospitals and FOHCS and rural health clinics and tribes and urban Indian health centers are just examples of settings that can provide substance use disorders and previously could not provide those services. And so we're really looking at how can we assist these organizations in really adding substance use to their scope of care by either hiring substance use providers or partnering with other organizations in their communities to strengthen that continuum of care. So really emphasizing the new partnerships with all of this. So when we talk about integrated care, it's not just building these services within your organization, but really looking at how to intentionally work with others in your community, and of course be aware of what is needed within your specific organization to provide the integrative care as well. A very specific approach of SBIRT, which is screening, brief intervention, and referral to treatment. This primarily occurs out of the medical setting or the primary care setting, which is really focused on, again, screening and intervening briefly for mild to moderate substance use issues, and then having partnerships and processes in place to utilize specialty care for those substance use disorders. So practice is really looking at implementing this as part of their IVH approach is an area of emphasis. And as mentioned in the American Indian area, we really want to help mental health and substance use providers strengthen their business development and revenue cycle. You know, oftentimes what we hear from folks is that there's a lot of difficulties with actually being provided reimbursement for the services that are already provided, and how to kind of really capture that in a revenue cycle way so that money isn't left on the table for the services that are already being provided in your organization. And we emphasize the approach of a community or regional framework for substance use prevention. So every community is part of a prevention framework. And how does that framework either get strengthened or really get enhanced with either the current partnerships that are there or bringing in new partnerships? So there's really a way for the substance use prevention services and the approach is to occur within a successful framework.
Scott, we just had a question asking if you could please define expert for us.
So SBIRT is an acronym that stands for Screening, Brief Intervention, and Referral to Treatment. And this is really an approach that occurs primarily out of the medical setting, but it doesn't have to. It can occur in other settings as well. And it's really to identify individuals that are at risk and have mild to moderate substance misuse problems. So it's had a lot of success in working with the screening and the brief intervention of those individuals that are using in maybe a high-risk situation, that having a simple screening and a conversation with that individual about their misuse is very powerful. And if somebody is having a dependency issue or is a very high-risk individual as far as their substance use, then those individuals often need more than a screening or brief intervention. But it's really a framework by which you approach the work. So it's not an intervention in and of itself. It's a framework and a model by which you approach substance misuse. And I think with that, we'll move on to the Partnerships for Better Health. So with Partnerships for Better Health, this is really a category that has a lot of things in it. And so within each of our focus areas, we really don't want people to get too caught up into which one is the best one to apply for. So we give guidance with that, and we hope that people can use that guidance to select the best focus area that fits their proposal. We understand that there is a lot of difficulties with accessing health services in Montana. We understand the workforce challenges, not only to recruit, but to retain and train staff to keep them healthy and active in their organizations. We also know that there is difficulties with reimbursement particularly for mental health and substance use treatment and who can provide those services. And we also know that healthcare costs are rising, and so we have all of this confluence of stuff, and sometimes communities are coming up with very creative ways on how they want to partner and address health challenges in their communities that maybe don't fit in American Indian health or behavioral health. So this is the opportunity to kind of really talk about what those challenges are and utilize our application process to identify those areas in the partnership focus area. So some examples, again, not a full inclusive list of the challenges that we've supported or that we've heard from, but community health workers, focusing on care coordination, community outreach, super utilizers, those individuals who are incurring the most costs in the community, but oftentimes have the most challenging way to coordinate care amongst partners, school-based health centers, and other social determinants of health factors that are more upstream that we know impact health in a positive way, but aren't necessarily part of the traditional health system. And any direct collaboration amongst agencies that maybe don't typically collaborate but have an important impact on the health. So this could be a social service agency partnering with a hospital, or it could be a domestic violence shelter partnering with a mental health center, for example. And oral health would be another category that would fall under this as well. And with that, we'll go into kind of more of the process of how to apply for these opportunities.
Great, thanks. And one other reminder on the partnerships or all our focus areas, you go to our website, you'll see a nice directory of our current projects in the state. It's an interactive map, and that'll give you a complete picture, of a little more detail around the types of projects we fund in each of these areas. How to apply? Again, the best way is to go through our website at mthcf.org, and in the top left-hand corner, you'll see a Apply Now button or a login button, and that'll allow you to get into our grants management system, which is managed by a third party, but it looks like it's a Montana Healthcare. It's seamless integrated into our website and into our platform. And you'll see a logon page. Our big caution here is that just check with your organization. We're trying to cut down on the number of duplicate users. And so just make sure that no one in your organization has applied. You can always call us to confirm that or not. You might have to switch the primary contact to your organization for this specific application. But if you're a new user, you can go ahead and create a new account. And from there, you'll go to our apply page, and you'll see different cycles, grant cycles there, and so you can choose which of the specific FOHCS areas you want to apply for, either the behavioral health, American Indian health, or partnerships for rapid response 2. Once you select that criteria, you'll be taken right to the application, and there's just 5 main focus areas. A lot of it will be your eligibility, demographic information, and then the meat of it will be your project proposal, and you'll answer several questions in there, and then a project budget that you'll download a spreadsheet and be able to upload it right in that same question. When you're ready, you'll submit the application, and you'll get a confirmation from us or from our grants management system within 24 hours. And if you do not receive that, just give us a call and we can track it down for you. And as you get into the application process, if you have any questions with that system, feel free to call our office and we'll walk you through the application. Timeline reminder is, again, the process just opened yesterday. It closes June 5th, and we hope to get a funding decision to applicants by July 21st so projects can start late July or early August. Now we'll go to our question and answer session. So please use your chat function if you have some questions, and Melinda will read those off and we'll do our best to address them.
Yes, or the question and answer section would be just fine as well. Whenever you're ready, we don't have anything yet. Aaron, can you hear us?
I can. Can you hear me?
Okay, great.
All right.
Let's see, our first question is, are letters of support and commitment from collaborative partners allowed to be attached?
Can you read it one more time?
Yes, they are.
Go ahead, Aaron, we can hear you.
No, I just said, can you read it one more time? But I think Ted answered just fine.
Okay. The question is, are letters of support and commitment from collaborative partners allowed to be attached?
Yeah, I agree with Ted's answer, yes.
Yeah.
All right. Anyone else? We still have about 20 minutes, so we can answer a lot of questions in 20 minutes.
Yep, we really encourage you to ask your questions. It's a great time, and we usually get a lot of good, thoughtful questions. So please go ahead. And again, as we're waiting, I want to emphasize the way that Montana Healthcare Foundation does its grant making is really by viewing ourselves as collaborators with applicants and grantees. So, as you're working on your ideas, if you want to talk with one of us, we do our best to be available. We're a very small staff for a large state, but we really do try to give you one-on-one support as well. Having said that, this is a perfect time to type in your questions, and we'll take care of as many of them as we can right now.
Okay, I have a few more coming in. The next one is, can a nonprofit apply if one has a fiscal sponsor located in California?
So if you have a controlling board that's Montana-based, I think that you would qualify as a Montana-based organization. I urge you to read our FAQs on what Montana-based organization means. And then if you still have questions after that, we'd be happy to talk with you one-on-one about that.
I've had a few questions about PowerPoint slides, and yes, they will be available after the webinar. We'll send them out, and they'll also be available on our website. The next question is there information available about reporting requirements?
We can cover reporting requirements just briefly here, but there is information available. So if you're awarded funding, we generally require brief financial and narrative reports every 6 months and one, including one at the end of the grant. We emphasize brevity, and we're not interested in having you spend half your time on the grant reporting to us, but we really do also want to know the most important parts about what's happening, both you know, any successes or particularly important successes, as well as any real barriers or challenges. We frequently do jump in and try to help people, you know, solve challenges that come up over the course of these grants. And so reporting can be one tool to kind of help identify challenges, as well as to help you just kind of get the word out about a program that's really successful and might benefit other Montana communities.
The next question is, do you fund proposals for completing a business plan to meet a healthcare need in Montana?
You know, without having seen the proposal, remember this is not a decision to fund your idea, but in general, yes, that is something that we would fund under the Rapid Response program. We really encourage organizations to think that way as well. I think when I mentioned the sustainability selection criteria, that's intended to really trigger people to think not just how do we design a wonderful program, but how are we going to sustain this without being always dependent on grants and donations and having to operate in an unstable environment. So business plan is a great place to start.
Our next question is pretty specific. It says, we are a 501c3 organization based out of Rapid City, South Dakota, offering historical trauma recovery. Do we need to partner with a Montana-based organization in order to apply?
So the answer is yes, because you're not a Montana-based organization, you would not be eligible to apply. But if a partner organization that does meet our eligibility criteria wanted to work with you, then they would be welcome to apply to us, outline what they hope to achieve, and then include your team or staff in proposed funding. We do urge organizations not to consider our grants as just a pure pass-through. So we would want more than just a name-only investment in the project on the part of the actual applicant. We'd want them to be a full partner. We'd want funding to go to them as well as to your organization. But you're an example of that they could certainly list you as a consultant or subcontractor on the grant if they chose to work with you.
And this applies even if that organization serves many different entities in Montana. Is that correct? It
does. That's right. We say to apply for the grant, you need to be Montana-based, and we recognize there are many national organizations that have a presence in Montana. We've chosen to focus our funding just because it's so limited on Montana-based organizations, but that's not to say that they can't have partners out of state.
Thank you. Our next question is, when you say high utilizers and super utilizers, are these just individuals who need more health attention than the average person, or did you mean something else by this?
So these are terms that are becoming increasingly common in healthcare and in recognition of the many studies that show that, you know, often on both public and private insurance, a small fraction of the insured tend to account for a large portion of health expenditures. And if you talk to providers who work in ERs, primary care clinics, or hospitals, you'll often hear that the people that they see most frequently are often people with a very complex, mix of mental health problems, substance use disorder issues, and chronic medical problems. Those people may end up in a cycle where they're in the ER or the hospital, in and out multiple times a month even, and can run up a lot of bills without necessarily actually getting at the root issues. So programs that are focusing on this group of patients are finding ways to connect with them and treat them more effectively in the outpatient setting, rather than spending as much time sort of spinning our wheels in the ER and hospital as we sometimes do. So that might include, for example, getting them referred for social services and housing support. It might include getting them, into regular mental health care or treatment for an addiction. It might even be as simple as getting them some peer support. But focusing on those patients is a great way to help contain healthcare costs, as well as to improve outcomes for people who really are suffering.
Thank you. Our next question is, can the funds be used for planning and implementation for the rapid response grants? An example would be year 1 is used for planning, and then year 2, the funds would be used for implementation of the expansion of the program.
Yeah, absolutely. We encourage people, if you think that the budget allowable of up to $75,000 under the rapid response opportunity is adequate to achieve both planning and implementation, you're welcome to propose that. That's a little bit different than for our large grants, where we tell people that you need to have done significant planning before you apply for a grant above $75,000. But I think for the rapid response, we would certainly welcome a proposal that outlines a feasible, realistic plan for doing planning in year 1 and some implementation in year 2.
Thank you. Our next question is, can community-based nonprofit organizations that are not healthcare organizations apply?
Absolutely. You'll need to, again, follow the selection criteria and really make sure you've thought through kind of how to address each of those. But I think as long as you're addressing an important health issue and have a strong sustainability plan and partnership, we might encourage you to think about whether there are partnerships within the health system that would really make sure that your project has maximum impact. You're certainly eligible to apply.
How many grants do you propose to fund in this cycle of funding?
So we don't have a limit. We actually, we expect to issue somewhere north of $5 million worth of grants and other charitable investments this year. That won't all be through this current rapid response call for proposals, and it will depend on how many large grants we end up funding, which we'll be making those decisions later in the summer, how many invited proposals we find, and sort of how our budget is tracking through the course of the year. So we don't really have one specific target for the rapid response.
Our next question is, does the applicant need to be associated or affiliated with an American Indian tribe, or is this only in regards to the American Indian Health focus?
So if you are applying for funds to work on an American Indian Health issue, you don't need to be formally affiliated with a tribe, but you should be prepared to demonstrate very strong partnerships with, for example, the tribal health department if you're working with a reservation-based community, or with an urban Indian health center if you're working in the urban areas. We really ask people to look to partnerships with the health system in some way, shape, or form as a part of their project. we work very, very closely with the health directors from Montana's 7 reservations, with the Little Shell Tribe, and with the urban Indian health centers in the state to address the health priorities that they've established in their communities. So we don't mean to say that those are the only people that can apply, and by no means are they, but we certainly want to see that applicants from outside the health system that serves tribes have at least looked at how to form a strong partnership with the health system.
Thank you. So we've gotten a couple of questions on where you think, or where we think that your specific project would best fit into our focus areas. And for specific questions like that, I think it would be best if you called into the office so that we could talk with you about it one-on-one instead of us discussing your project over the webinar. But please feel free to call us, and we're happy to talk with you about where you best think your project would fit.
Right. So I was just going to say, we try to avoid getting into the nuts and bolts of, or the substance of a specific proposal on the webinar, but we're very happy to talk about it one-on-one.
Yeah, and we can help direct you to what application process would be a best fit. And Aaron, I just want to go back to the last question. I don't know if the question alluded to the fact that we do not only fund American Indian projects as well. We do fund, all over the state, all different types of projects. But if it is focused on that population, we have 2 channels through that, either through the American Indian process, if you are a reservation-based organization, or through the other one, partnership, or the behavioral health. But if you are focusing on that population, we want to see a strong linkage. But that does not mean that if you do not serve that population, you can't apply.
So that's all of our questions so far. Please feel free to submit more if you have them.
Yep, we've got a few more minutes, so go ahead.
Just a quick reminder, a recording of the webinar will be available on our website probably by this afternoon, and we will send you a link to that and a link to all of the slides that we used in the webinar. I'm not seeing any more questions.
Okay. Well, if no questions come in the next minute or so, I think we'll go ahead and end the webinar a couple minutes early. I do want to make sure you understand, if you get into the proposal process and have questions for us, we are always available. Feel free to email us at the contact information on the slide, or give us a ring, and we hope you'll all apply.
All right, it looks like everyone's logging off. Thank you so much. We really appreciate your time today. All right, Aaron, I think we're going to end the webinar.
Okay, sounds good. Thanks everyone for coming.
Thank you so much.